And I was basically told that in order to receive treatment, I would have to abort him. And yeah, I was pretty shocked. I said, because with science today and everything else, I thought there must be something they can do.
Better to have a short life that is full of what you like doing than a long life spent in a miserable way.
Hey. Yes. So I do want to just transition this because I want to just preface this by saying that a lot of nurses, like a lot of healthcare providers, they get into nursing because they have taken care of a family member. They get into healthcare because something happened dramatic in their life. And it says, like, I want to be the person to help another family, another human being, another patient through this process. You are one of the very few people that have lived hard, really heavily in both the healthcare. Like, I am the healthcare provider and the patient side. Mm-hmm. I don't want to say any more than that. Could you just please explain to me and the people your story? Just tell me your story when it comes to how you have dealt with going through cancer that you've been dealing with literally your whole life, the majority of your life.
Yeah,
so
good
why don't you tell me that?
Yep. So let's see if I can remember back. See, my son is now 16.
Congratulations.
So, yeah, when he was, I was pregnant with him is when I first got diagnosed the first time with breast cancer. And I was basically told that in order to receive treatment, I would have to abort him. And yeah, I was pretty shocked. I said, because with science today and everything else, I thought there must be something they can do. And that was the oncologist who told me that before I could have treatment, I would have to abort. And I thought, oh, there must be something else. And then my OBGYN, who's fabulous, had said, well, let's get another opinion from the
Please,
two, let's,
oh
my yes,
God.
Absolutely. So he had me go to the tumor board at Rhode Island Hospital, and they all met, examined my case and said, no, she can have the baby, which was great. So I actually went through cancer treatment while pregnant, and he was perfectly fine, born healthy, thank God. And then after I had him, I had more chemo and radiation. I wasn't sick a day being pregnant, which was amazing. I was in my master's program. I did take a year off of school because they said I had to, but I really probably would have kept going. But, and I wasn't sick a day though, but I did take a year off of school and I did graduate. I went back to school and did graduate with my master's. Fast forward to 2015, I got breast cancer again in the same breast. This time they required mastectomy. So I did have the mastectomy, of course, recovered fine. Everything's been negative since. I'm fine, healthy. Everything's good. So
congratulations.
Thanks.
Of course. So listen, let's back this up because I know, so she's making it sound like,
I know.
She makes it out to sound like such an easygoing process, but like the mental stress that you must have gone through when your chemo doctor told you that you need to abort your kid to have the treatment to save your life.
Yeah, that was stressful. Yeah,
that is insane.
Yeah,
that is insane.
Yeah,
I hope you have a different. Okay, let's.
Well, I still have that same oncologist.
Oh my!
I know.
You're
I know.
Trusting.
I know. And she did apologize. Really, I mean, she really did. Because she said that she had no idea. She'd never treated anybody that was pregnant and had cancer. I mean, she just had never heard of such a thing.
Yes.
And so she did really apologize. She had no idea. So it was really something else.
See, that's super intense. And I like, hats off to you. But I just want to just mention this because this is the only time, I don't want to say the only time I felt bad about being a nurse. And this was even before I was a nurse. But so like I said, Professor Brose here, she had me in our class. She had a scenario, like one of those scenario papers that we do, like, clinical studies that we do. And she didn't tell us that it was her in the beginning of the class. So everyone went through the class and we were looking through this case study and we were doing the case study. And in the case study, they were talking like the patient was concerned about losing her hair, right? And I'm hardcore like, oh my goodness, who gives a shit about the hair? Who cares about the hair? I was like, let's take care of the kid. Let's take care of what needs to be taken care of.
Right.
And then at the end of the class, when you said that it was you, I think that was the first time like I felt like a bad nurse, right? Like, and as a nurse now, it's very clear to me that it doesn't matter if you treat the patient for who, like, okay, we take care of the cancer, we take care of the broken leg, we take care of the heart attack. If that patient doesn't have what they want to live for, why does it matter?
Right.
Like, why? Why are you saving this patient if the only thing that they care about is no longer there, right?
Right.
And then you just mentioned the thing about your kid. Tell me the mental, like, how did you go through that process? Like, because you just made it sound like, yeah, you were healthy, like you were physically healthy, but how, like, what were you doing to get yourself through that process? Because that sounds just so difficult.
Yeah, it was. I mean, I had my moments, I would think, in private where I was really distraught and upset. But I felt like through the whole process, I was trying to be more positive for everybody else.
Oh, my God.
Yeah, and that's tough because I think everybody else took it harder than I thought they were, and so I was trying to be upbeat and positive, like, it's not a bad thing. Look, I lost my hair, and I would, because I was wearing a lot of, wigs and whatnot. But then one day I was with my family and I just said, you want to see what I look like bald? I was like, and I remember my dad kind of looking kind of funny, like, I don't know if I want to see that. I'm like, it's okay. It's all right. And so I think everybody was very scared when I was going through treatment. And I think I just wanted to make them feel okay. And like that, I'm going to be fine. Everything's fine. I'm going through treatment, but I'm healthy. I don't feel sick. I wasn't sick a day. I really wasn't. And I was pregnant at the time.
That's
and
incredible.
So, yeah. And so I just wanted to make sure everybody knew that everything was going to be all right. So I felt like I was reassuring everybody else. And that kind of helped me keep going and just being positive. I mean, I didn't have no downtime. There was just no time to be negative or,
Can I ask you a real question?
Yeah.
Are you resentful for any of this? Like, do you feel like, I feel like that's so much weight on your shoulders. You're pregnant, you're going through chemo, you just got diagnosed with cancer, and this entire time you're trying to make everyone else feel okay. Like, I would be the most bitter human being on the, like, I can't, like, that's so much.
But, I was a lucky one, I guess. I mean, twice, getting hit with it twice. And the second time, maybe I was a little bit nervous,
of course,
but I think I had really good doctors, and I think they really gave me the right direction, the right treatments. They basically told me this is what's got to be done, and I'm like, you do whatever you have to do because I want to live,
of course,
basically.
Yeah.
But yeah, the whole key is just to be positive. But I never felt resentful about anything. I never felt
not bitter, not upset. You never got annoyed by trying to make other people feel comfortable with your illness?
I don't think so. No. And I think made me a stronger person going through it. I think I'm a better nurse for it. I mean, I think when I go to clinical with students and I explain to them, just put yourself in their position. How would you feel? And think about their family. What do you think they're going through? They just got a bad diagnosis. I mean, how would you want to be treated? That type of thing.
And like that case study we did in your class, I think that's the one that's like whenever I'm thinking of like, because you have a lot of patients that are like, I want to leave AMA. I don't want to do this treatment, or like I want to go the extra mile and try something brand new.
Right.
And like as a nurse, I'm like, no, this is not what you should do. But that's every time I feel that way, I think about that moment in class.
Oh, wow.
I think about, it doesn't matter what I want. Like, let's figure out what the patient's goal is.
Right.
And whatever that goal is, let's go for that goal.
Yeah.
If that patient's goal is, I want to see my fish again, I want to go for a walk again, it doesn't matter what we are going for that patient's goal. It doesn't matter if that means I'm going to live another 50 years or I'm going to live another week. Right. So, I have to say that's one of the moments in nursing school that I remember the most clearest, because I was like dead wrong on all of it.
Wow.
But like I learned, like it just sticks with me. I have to just say it sticks with me the most, and I remember it quite often.
Oh,
So